myself, Dr. Timmanna Giraddi, physician. Today we'll be discussing about how to manage and how to ease the symptoms in case of GERD when patient is already having diabetes. As we know, diabetes itself can be a problematic. Along with that, prolonged medications in diabetes itself can cause gastroesophageal reflux disease. As we are aware, GERD itself is a reflux of acidic contents from stomach into esophagus, which will cause symptoms like chest pain, burning sensation, which can mimic like myocardial infarction. So, if we can ease these symptoms without medications or with medication, we can reduce the symptoms along with diabetes. So, when managing both diabetes and symptoms of GERD, it will help our patients to stay healthier and feel better. So, as we know, GERD and diabetes, it is important how to understand the impact of food levels which can trigger acid reflux. So, whichever foods trigger these acid refluxes like coffee, tea, cola, carbonated drinks, citrus drinks, tomato juice. These, if we avoid them before lying down or before sleeping time, or if we avoid them after exercising, we can prevent symptoms of GERD. So, whenever like irritant fluids, what I mentioned, which cause reflux of food from stomach to esophagus. As we know, acidic contents from the stomach should not reflux back into stomach. Esophagus. Esophagus itself is a food pipe which contains two sphincters. One is upper end, another one is lower end. Upper end sphincters, both sphincters will be already always will be closed. They open only when food enters through them. So upper sphincter will open when food enters from stomach into esophagus, and lower esophageal sphincter opens when food enter from esophagus into stomach. So when food passes from through those sphincters, after passing the food, they should close so that it will help them to prevent the backward flow of the food. So in mainly GERD, the problem will be with lower esophageal sphincter. So nutrient rich fruits, vegetables, whole grains, these should stabilize the sugar level, and these will less stimulate gastric reflux, and they will be help to avoid sudden shooting of the sugar level in elderly patients with diabetes. Some foods like refined carbohydrates, for example, snacks and white bread, they trigger the sugar levels and they shoot up sugar levels. So they should be avoided in diabetic patients. Usually, diabetic patients should avoid large meals. We always suggest them to have short, frequent meals so that sugar level should not shoot up and should not take too much time to digest. So, if we have a hard food or a large meal, it will put a pressure on lower esophageal sphincter. So it will stimulate the sphincter and it will cause dilatation of the sphincter. So it will lead entry of acidic contents from stomach into esophagus backwards. In some people, what we suggest is they should avoid minimum 2 hours eating these stimulant food before going to bed or before going for moderate stress exercise, because we ask them to avoid high intensity workouts in diabetes itself. So always have a balanced food in diabetes, which is very important. Balancing food and diabetic medicines both is important, because diabetic medicine itself can cause uh, gastric irritation, and we can't avoid those medications. So we have to balance both food and medications. So too little food with regular medications can cause hypoglycemia in patients. So sugar will come down. Patient can have symptoms like blurring of vision, sweating, drowsiness, giddiness. So some patient go into complete unconsciousness. So if you eat too much food with regular medications, so sugar can shoot up. So if you eat less, there is a problem. If you eat more, then also there is a problem. So in diabetic, we need to have a balanced food with balanced medications. So to balance meals, we should prefer to have a plate method, which contain, like, in if you consider a 9-inch plate, if you, for example, if you take 50% of the food, it should always contain non-starch vegetables, green beans, like all the vegetables, uh, cucumber, whatever you take example. One fourth should contain like plain lean protein, for example, beans, legumes, egg white, fish, and remaining one fourth of the food should contain starch, uh, and starch containing vegetables and fruits. In some patients with GERD, as I already said, they will be having weakened lower esophageal sphincter. So lying down after having food will be problematic for them. It will cause heartburn. It can mimic like a chest pain, and patient might get confused with, they might be having heart attack. So if we avoid those symptoms, we can avoid the confusion. Whenever patient, like after having meals, ask them to sit for upright position for minimum 45 minutes, which help them to relieve the symptom. And if patients persistently having the symptoms, we ask them to use like elevated position, elevated bed if they are having, or use two pillows, so that esophagus will remain above the level of stomach, so we can avoid reflux of the acid from stomach into esophagus. And we always advise them to avoid strenuous physical activity after having the food. So drinking alcohol is always dangerous in diabetic and non-diabetics. So we should always advise them to avoid alcohol, because alcohol, what it can cause is, it will cause low blood sugar levels, and in some patients it can delay the gastric emptying, and it will trigger uh, food remain in stomach, and it will help to regurgitate acid and food content from stomach into esophagus. So avoiding alcohol is best solution in gastroesophageal reflux disease patients. So managing both GERD and diabetic together is very essential for the patients of well-being. And by making mindful choices, like for example, I told balanced meals. Why balanced meals is important, I already told, because if we eat less with our regular medications, patient will go into problems of low sugar levels. If we eat more with balanced medications, patient will go for hyperglycemia. Again, it will be problematic. So balance food with balanced medication. So eating same quantity of foods regularly, it will be definitely benefit for patients, and they need not take higher doses of medications. And second point is, avoid triggering foods, for example, citrus juices, carbonated drinks, spicy foods. These, as you know, always trigger foods from entering back into esophagus. If we avoid them before taking nap, or before lying down, or before going for sleep, minimum before 2 hours, then we can cause them to. And balancing the diabetic medication, it will definitely help, and to maintain stable sugar levels in case of uh, diabetic patients and non-diabetic patients as well. And as I said, GERD itself will be confusing for acute MI. So if we get any symptoms of chest pain, burning sensation, or regurgitation, should not get confused only for GERD. Get a examined by your physician, get checked by ECG or echo once in 6 months. It will be definitely helpful to avoid all the confusion, because MI can typically mimic like typical symptoms of GERD. So if we get evaluated and ruled out by physician or your family doctor by taking ECG and confirming it's a normal, then we can go for a diagnosis of GERD. And by following all those steps and avoiding all those things, we can maintain healthy life and healthy lifestyle. Thank you.